Hello, my name's Heather. I'm the nurse here at FourEver Smile. I wanted to go over some post-op instructions with you. Everybody's different, so what you're going to experience may be different than what somebody else will experience in terms of discomfort, swelling, bruising. So I'm going to go over all of that with you. Swelling. Swelling can last up to 3 to 4 days after surgery. So if you look like a chipmunk, that's completely normal and to be expected. So if you do experience significant swelling like that, we want you to ice 20 minutes on, 20 minutes off, and keep your head elevated. So what you want to do, if you have a recliner at home, that would be best to sleep in. Or if you're sleeping in bed, you could just prop your head up on some pillows and that will help as well. Bruising. Again, everybody is different in terms of bruising. If you are on any blood thinners or take any herbal supplements like fish oil, garlic, turmeric, that may increase your risk for bruising. You may have bruising under your eyes, around your lips, jaw, chin. Sometimes even we notice bruising may go down your neck around to your chest area. Again, it may be nerve-wracking to see, but it's completely normal. Bleeding. Bleeding is something that not everybody experiences. Slight bleeding is normal. However, if it becomes a little bit more excessive and profuse, we want you to contact us right away, and we can give you tips and tidbits on how to lessen the bleeding. For example, you can moisten a tea bag and bite down gently, and that can help. Also, just the gauze that we send you home with, keeping pressure on the area that seems to be bleeding a little bit more, will be helpful as well. Pain is the biggest question that everybody asks if they're going to experience. Unfortunately, I cannot say if you are or aren't going to experience pain. Slight discomfort is to be expected. You are having surgery, but pain, everybody's different in terms of their tolerance. We will have medications to help with that, icing, elevating, and if you follow all the instructions, everything will be okay. Sutures. You will have sutures in your mouth. They are dissolvable. You may feel little strings hanging down. That's completely normal. Try not to bother them, and they will dissolve on their own. How the temporaries will affect your speech is another post-op question that patients ask. The temporaries are very bulky, so it may affect your speech for a short period of time, but it will normalize over time as you heal. It's just an adjustment. It's going to take a little bit to get used to, but I promise you it will be all great in the end. It is very important that you follow all the instructions that we give you on the day of surgery. You're going to use gentle, warm saltwater rinses the day after your surgery and for 1 week. So I mean very, very gentle rinsing. So you're going to put the water in your mouth. You're going to gently move your head from side to side and let the water just drip out of your mouth. No vigorous swishing, no spitting, anything like that. We want everything to heal properly, so be sure to follow all those instructions that we give you. Be sure to avoid smoking at all costs. Smoking affects the healing of the implants, so it's very important that you don't smoke. Limit vaping for the immediate post-op time period. Marijuana. This is another thing that we want patients to avoid. If you do want some form of marijuana, we suggest to all of our patients that they switch to gummies. Not the gummy bears or the gummy worms, but something that can melt in their mouth, maybe like an oil or one of the chocolates, something similar to that. If you have any questions, any concerns, please don't hesitate to contact us here at the office. We'll be happy to answer any of your questions and are here for you always.